Hi, I'm Nancy Kerrigan, and I work in the as a counselor in the department of for the deaf and hard of hearing. How can I help you?
My name is Amber Carson, and this is my new baby. He's only about 4 days old. His name is Doug. And at the hospital before we left, they did some kind of test, and they just gave me this paper, and it said that he was deaf, and I just don't know what to do. So they told me to come to your office.
You did the right thing by coming here tonight. I can provide information and help to you. Specifically help for the baby. And with this program, we can help you develop a better understanding of the resources you have. And not only the resources that we can provide for you, but other agencies can provide for you as well, including education programs for the deaf and hard of hearing children. And also we can provide services for a language mentor if you would wish to learn sign language to communicate and develop language skills with your child. What do you think? I know it's a bit overwhelming, and I understand it's a difficult time, but you've really come to the right place. You really have.
I'm really scared. I just don't know what to do. I've never even met a deaf person, and there's nobody deaf in my family, and there's nobody deaf in my husband's family. We just don't know what happened, and I don't know how to use that sign stuff, and somebody said don't sign with the baby, and I just want him to be able to hear my voice.
Well, you said the baby is only 4 days old. So perhaps waiting a few months, maybe 1 or 2 months, you can go back to the physician or the doctor and get another hearing test done. Sometimes, when they first test the baby, the test isn't always accurate. And then a few months later, the test comes back and it says that they aren't deaf or hard of hearing and they are not conclusive with the last test. And it's important to take the hearing test as they reach important milestones, as the child grows older as well. And with the test, they actually specifically test how the sound waves are connected to the brain and how the brain interprets the sound waves.
So
and they can also test the pressure.
How do I talk to my baby right now? I mean, he's nursing and things, but...
Oh, of course you can go ahead and talk and communicate and make noise around the baby right now. You can sort of coo at them and baby talk. Use that as a resource. And you can also... You can go ahead and use your voice and facial expressions. That's fine.
So the only way I can talk with my baby is to do what you're doing?
No, there are other various methods and other ways. Sign language is one, and just facial expressions is important. And visual cues are very impactful as well. It's not necessarily sign language, but it can help, and it can teach them to learn how to sort of pronounce the words and accurately verbalize the words.
But if
by watching your mouth.
Completely deaf, and you do an oral method, is he gonna hear anything, or would it be better to use some visual with him?
It's better to use some visual cues with any baby, really. For example, flashcards or pictures. Sign language can really help any baby learn speech better. Sometimes babies don't necessarily pick up on speech as quickly as they do with sign language. So that can benefit you and
So
help them communicate
you're saying
better.
that Dougie's going to be able to sign to me soon?
Yes, and it really depends on if we go ahead and include you in our program with the deaf mentor. A deaf individual will come to your home, they'll sit down with you and discuss the program, and they'll actually teach you sign language. And as they're teaching the baby sign language, what you'll do is copy and emulate them, so you're learning the language along with the deaf child or your child. And really, it's not just for you; it includes the whole family, and they can all learn how to sign with the baby. And it's important that the child learns these language skills for later on in life. It's very important to help them communicate better.
I think that's really great if someone could come to my house, because my husband, Jim, and I, we decided that Dougie should be at home. And so I have put in a leave of absence from my work for the first year. And could the mentor come at night? My husband works until about 3.
Yes, of course. And we'll discuss that. And really, they're very flexible with the scheduling, and we'll work out a specific time frame that works out best for you. And remember, this includes the whole family, your brother, your sister, your husband. We want everyone to be involved so they can all communicate with the baby.
I feel a little better. I just have one last question. So if other things come up, and I mean, we don't know what to do in 6 months or a year or 2 years, is this a place where I can come to get more information, or can you just help me this once?
No, anytime you have a question, feel free to come here or contact me. And in fact, I have some information I want to give you today to take home. So this information is what happens within our program. And this is a program that will tell you about educational resources or related to educational resources for the deaf and hard of hearing children. And this one tells you just general information about children with hearing loss. And this is our commitment to services for parents of deaf and hard of hearing children. And this is information, I want to provide you information that is about different various events for families with deaf and hard of other families with deaf and hard of hearing children. And really, it's great to have the support of other parents. So we'll ask those individuals if we can give them, or if we can give their information to you so you can have that support system and communicate with them. And also the deaf and hard of hearing children can communicate with your baby as they grow older.
So new to us. We're just not sure what to do. As I said, we have no deaf experience at all. And so this was pretty frightening when we found out. We just didn't know what to do. I mean, we love him because he's our son, but I want to be a good mom. We want to be good parents.
Of course. And that's something that's totally normal. And this can happen to really any parent, and it's not just you. And so having relationships with parents that are going through similar things is a really great thing. Thank you.